Hey, what's up, everyone? Dr. Nate here with Andrew.
Hey, guys.
You've seen him before. He asked me all the questions. He's our social media director here at Catalyst Wellness and Physical Therapy. Today, we're going to be talking about degenerative disc disease again and how to prevent it from getting worse. Specifically, how to prevent really back pain that might be related to that from getting worse, right? Because ultimately, I think a lot of people want to prevent the degeneration from happening, but really what they want is to prevent symptoms from getting worse, right?
Yeah.
Assuming that symptoms are coming from that.
Exactly.
So
for
don't
people,
know where you want to take it from there.
So for people who haven't seen the last video, degenerative disc disease, DDD, is a disease which the vertebrae kind of get compressed because of aging due to just degeneration. Like, we're getting old, so there's a
lack of hydration,
and those discs begin to just minimize. And certain activities and certain things can actually kind of speed that process up, or you can be told that, like, hey, like, because of you doing this kind of sport, you can basically like be told that you have DDD. So like for me, I was doing gymnastics and I had and I stopped doing gymnastics, but basically because of doing gymnastics over the years, I had a little fracture in my spine from extending, as you can see from the previous video. And they found, they're like, hey, you actually have DDD. And they think it was from the compression of, like, gymnastics, high impact sports, which is really compressing. But it's really hard to tell exactly, like, specifically one thing. Usually it's indicative of like numerous amount of things, but
one factors.
Yeah. So one thing that none of the doctors actually helped me out with, like, when you go to a doctor's, they give you they offer you medication, they give you x-rays, and they just refer you to physical therapy, but they don't really inform you what this condition is. So that's what the condition is in their last video, but this video is specifically talking about like how to prevent it and how to treat it. So there's a couple of things that some doctors told me, but I'm curious on your end, like if you had a patient, if I was your patient and I came in and I was like, hey, I have DDD. How do I prevent this? How do I get better? What would you say to them?
Well, first of all, I would start with just figuring out, what caused. Was there like a precipitating event that caused these symptoms to come on, right? Because I think we've talked about this before, that in many cases there are symptoms that come on from a specific event.
Yeah.
Right. Or they come on a little bit over time, then maybe they get worse. And it's possible that the degeneration was there already. Right? Like it was there long before you developed symptoms. In fact, that's probably the most plausible thing, is that those symptoms are there, right? Or the degeneration is already there. Symptoms came on a bit later from some event, right? So I think that's probably the most important thing to understand from just an etiology standpoint, or like how something starts. And then I would go through a physical exam to kind of see if there are specific movements that aggravate things, right? So if it's specific movements that aggravate things and you have a specific cause or some event that took place, it's pretty clear that we can make improvements on that. In terms of making because I think you asked this, and redirect me, my brain is going all over the place, but
no, you're good.
In terms of like preventing it from getting worse, I don't know that it's helpful to think of like preventing the degeneration from getting worse. Of course, if you really want to try to do that, having a diet that is not high in processed foods, that's more that is lower on the inflammatory scale.
Yeah.
So like a low inflammatory type diet, making sure you're getting enough exercise, getting enough sleep. So all of those all the things that are just good for you generally are going to help reduce the risk of degeneration, right? And this includes like cartilage degeneration in the knee, in the hip, the labrum, and the shoulder, all that type of stuff.
What are your thoughts on like stretching? Because that was something that was recommended to me as well. So if you have like DDD and you're stretching, kind of finding good stretches that feel good, like a little like child pose or something, like where you're really stretching that, like elongating that back, like are those good for degenerative disc disease kind of like patients? Or what would you say?
I don't even know that I would call people like degenerative disc disease patients, because it's such a prevalent thing that there are so many people walking, like almost everybody on earth is walking around with some amount of DDD. Yeah. So I don't know that if everyone has this. Does everyone have this disease? Does everyone? Basically, I mean, I was actually watching a video the other day that I was talking about how we don't view aging as a disease or an illness, but we might start looking at it as a disease because we might be able to live forever. I don't know. I mean, that's what they're saying. That's what they're saying. I don't know if I agree with that. But as far as degenerative disc disease, I don't know that it's necessarily a disease. And really, and correct me if I'm wrong, but are you asking that how do we prevent symptoms from getting worse? How can you prevent like the actual pain from getting worse? I
would say both. Like for me personally, I don't really have pain, or at least, so there's two things. I have spondylolisthesis, which is a fracture in the spine, but I also have spondylolithosis, which is like kind of like an angled tilt, and then I also have DDD, and I have like low back pain for certain things, but it's not like, oh, like this thing causes this pain. It's kind of like accumulation of like a whole bunch of things. So that's also kind of hard. It's like is DDD really causing the pain, or is it like my little fracture or whatnot? But I would say like for like preventative, like I guess it would be just to like live better. Like how would you increase that space without having to get injections or basically just deteriorate? Like, is there anything that can help improve that space where you can do better and feel better?
I don't think there's anything you can do to increase the space. Mm-hmm. I know that people will do like traction and all that, but that's not actually going to increase the space. Like if you put a measurement tool inside the disc and measured if it was actually increasing in height, I think the only way you'd be able to do that was like injecting it with some sort of hydration, like some sort of viscous material, which I don't think that exists. Mm-hmm. Maybe it does. I haven't seen it. But so I don't think there's anything from a purely biomechanical standpoint that's going to increase that disc height. What
about things that like not prevent it from decreasing as fast? Like if like for me doing gymnastics, high impact sports, maybe doing that may or may not be, but what's something that we could be doing just to like, slow the process down from kind of rubbing on bone?
I don't know that we have a good answer to that. Mm-hmm. I don't know that is something that we even need to concern ourselves with, because if there are a lot of people living with this and it's a normal part of aging, then it is probably something that we don't necessarily need to worry about too much. Yeah. So things that are just generally good for your health, having a healthy diet, getting your exercise in, having healthy relationships, making sure you get enough sleep, like all those types of things. Just make sure you're doing that, and you're going to take care of most of the bases. And that'll give you your best shot at reducing. There's not like one specific stretch or one specific exercise that is going to reduce the risk of the disc height narrowing. Like there's not. I mean, you can, if you're doing like high level athletics, it is possible that can lead to quicker onset arthritis and things like that, just because you're pushing your body to its absolute limit. It's certainly possible that that's the case, but you're an elite athlete, right? Like you don't care about that. You're just going to go. Now, of course, like Tom Brady and LeBron James and a lot of high level athletes, they spend millions of dollars a year on trainers, therapists, equipment, you name it. And so they're trying to keep their body as fit and active as possible for as long as possible. And who knows? We'll see how their body. I'm actually really curious. Russell Wilson, I think, famously spent like literally like $1 million per year on just self-care. Wow.
I wish I had that money to do self-care.
Right? So I'm just curious. I want to see like what their body looks like when they're 60 or 70 or 80. And it might be that they're totally fine, and that the $1 million they spent did keep their body from kind of going through the aging process just like everyone else. But I guess my point is that the degeneration, whether or not it happens, it doesn't mean that you're going to have pain. If you do have pain, it could be related to that. It could not be related to that.
Yeah.
Ultimately, what matters is, can we get you back to doing the things you want to do? Can you live a life that is high quality? And can you just enjoy your life as much as possible, right? And I think that that is the case, regardless of whether you have degenerative disc disease, stenosis, spondylolisthesis, or anything else. It's a matter of getting back into activities in a progressive manner.
Yeah.
And then just continuing on that path.
So
I think that's the main thing.
To like wrap things up a little bit, like just to like sum everything we talked about, so basically there's nothing like I would say preventative that we know of so far, just because the disease is so new and we kind of all have this kind of like, degenerative disc disease, if you want to call it a disease. But is there anything that we shouldn't do? So we know, like, if you're doing things like stretching and it feels good, like, keep doing it. If you are like running and it feels good, keep running.
Yeah, keep running.
Is there anything that we shouldn't be doing to keep this from progressing?
No. I rarely tell people to stop doing things unless it's just continually aggravating. I was just around the dinner table with family about 3 or 4 days ago, and it was aunts and uncles and myself, and a lot of people were just talking about how, well, they stopped running because of this, or running, like, it comes up at the table even when I'm there, and like no one asks my opinion, and they know I'm like a therapist. It's like the weirdest thing ever. But anyways, if you're watching this, family, now you know.
Shots fired.
But it's people have these opinions that running is bad for your knees or your back or your hips, or squatting is bad for your knees, or deadlifting is bad for your back. And, you ask them why, and the conversation kind of ends there, because it's just kind of things people say.
Or it's because somebody told them
Or somebody told them that, or maybe they had an experience where every time they ran, their knees hurt. But I'll tell you what, if I haven't ran for 2 months, guess what? My knees hurt. Because it's a new stimulus.
Yeah.
If you're doing something that's new, it's probably going to hurt. And so you have to progressively go into it, right?
Yeah.
Oftentimes people will say, like, oh yeah, that really hurt when I did that. I was like, oh, did you what was your RPE when you did it? RPE being like the difficulty level, like, oh, I killed myself with it. Like, well, of course, like 10 out of 10 RPE, of course it's going to hurt. Yeah. So anyways, I'm getting on a tangent.
No, you're good.
Kind of rambling, kind of raging. Don't shut down an activity you really enjoy. Like, adjust it, modify it. Maybe you have to do it at 20% for now, and then you can build it back up. But don't give something up you really enjoy just because somebody told you had to. Yeah. Like, it's rarely the case.
I think that's good advice. Just kind of listen to Dr. Nate and listen to him.
That's right.
All right. Well, if you have any other questions and you need to reach out personally about degenerative disc disease, you can always reach out to me, or you can always reach out to Dr. Nate. He has his online platform where you can actually talk to him personally and ask him any questions that you have, whether degenerative disc disease or not. He's always here for you, as well as I, but I'm not a doctor, so probably best to go to him.
You just play one on the internet? So yeah, please reach out. You can send us a comment. You can send us a message on Instagram, Facebook, TikTok, whenever that comes out. I'll Google my business. Lots of different places. But thanks for watching. Thanks, Andrew, for asking me these questions.
Anytime.
And we'll see you in the next video.
All right. See you guys.